If we keep doing what we've always done, we're going to keep getting the same results. The results we are going to talk about right now are the results around cardiovascular disease. It's the leading cause of death. It's the leading cause of healthcare costs in Australia and globally. In Australia, it costs us about $1 billion a month to manage cardiovascular disease. In the US, it's $1 billion a day. And these results are not sustainable. They need to change. In Australia, each year we have about 1.1 million hospitalisation events to do with cardiovascular disease, and many of these events are preventable, avoidable admissions. Now, we know cardiac rehabilitation is a model of care that actually can make a significant difference on the risk of re-event, on the risk of readmission, and on the cost of healthcare. We know that the model works in lots of different modalities. And it's a model of care that should be offered to every single patient who presents to an emergency department, has a procedure for cardiac disease, or is at significantly high risk of having a cardiac event. But the result we are going to focus on, and Cardihab is hell-bent on changing, is this one. 80% of people that should be in cardiac rehab don't participate. Now, cardiac rehab traditionally is a model of care that goes for 6 to 8 weeks. It's usually centre-based, where there's a gym, clinicians looking after patients, providing them with education on medication, lifestyle change, risk factor modification like reducing cholesterol, reducing salt intake. The program is usually 2 to 3 hours a session and largely based in metro centres. So if we ask ourselves, why don't people participate? It's because of the structure around traditional cardiac rehab that limits their uptake. People that live in regional and rural communities can't get to a metro-based regional rehab centre, so they don't go. People that live busy working lives can't accommodate the time that's required for rehab, so they don't go. Often women choose not to participate in cardiac rehab because they're mostly male-dominated groups. They feel uncomfortable in that environment. They feel intimidated by the male domination, so they choose not to go. And I guess during COVID, heartbreakingly, most cardiac rehab centres were shut down. So cardiac rehab centres that were fighting to keep their services alive pivoted to digital health or pivoted to telehealth to try and keep people connected to care. Now, Cardihab was a product that was discovered by the CSIRO. We spun out of CSIRO to try and solve this problem. And through a randomised controlled trial, we proved that we could. We can actually improve participation. We can improve access to care, and we can actually get the same, if not better results than a conventional program. So we've actually demonstrated in that study that we can get these results to change. And we're very proud over the last 3 years to show that the results aren't just what was seen in a randomised control study. We're actually getting real life results of this sort of change that we want to see in cardiac rehab participation. But what we see as, I guess, the biggest opportunity is if we really want to see a big dent in that 80% statistic, we need to change our mindsets. And that's every single person in this room, every person streaming, and every health system, to change it from looking at cardiac rehabilitation from being a versus conventional versus digital to actually think about how can digital health augment, supplement, or alleviate the pressure on my conventional program so that we can treat more people. How can we make sure that people are given options of how they want to complete their cardiac rehabilitation program that's convenient to them and actually enables them to feel committed to a program of care, deliver on that program of care, and see the results and benefits for themselves and their health. And we only do this if we start thinking about how can digital help, not how does it work against the conventional model. We're not taking anyone's jobs. We're giving technology to people so they can do their jobs more efficiently. But what's missing is the funding piece. That pressure that sort of says, well, I only get funded if I do things face to face. If there's a person in front of me, I get funded, so therefore I'm going to do that. Otherwise, I'll lose my funding. We've got to break that paradigm. We've got to start moving about more abrasive models. So really, we can do this if we power by the cloud, enable technology to come into the way that we care for patients. And we actually start thinking about the patient as the thing that we're trying to help. If we give patients the options of validated programs, and we are clinically validated, TGA registered, then we can actually start making a difference on that result. So for the person who really wants face-to-face, they get to go to face-to-face. The person who really wants to be part of a group session goes to a group session. And the person who cannot attend a group session because they're based on a farm in Queensland goes to do their rehab over the phone, virtually with their clinician. It's only when we give more options to people to engage with their health, the way that they want to be rehabilitated, that we'll get the increase in access to care, we'll get increase in participation rates, and we'll actually see the 80% result change. And that can only be powered by the cloud, because we can't keep doing what we're always doing and relying on physical infrastructure to make these results change. So that's what we're trying to do with Cardihab, and we'd love everyone's help to get there. Thanks.